Again, my name is Marcy Biller. Thank you so much for having me tonight. I know we've been sitting for a while, so before I get started, if you're comfortable and if you're interested and if you're safe, please stand up. Let's stretch for just a moment. Let's take both of our hands up over our heads. Clasp your hands together if you're able to reach. Stretch up really high, or just one arm is good too. Let's stretch over to one side. Feel a nice stretch on the side of your rib cage. Let's stretch over to the other side. Feel a nice stretch in your rib cage. Come all the way back to the center. Let your arms go. Squeeze your shoulders up really high and hard and squeeze and let them go. And sit down and relax. Just wanted to get your blood flowing a little bit. And I'll talk about why we did that. There actually is a method to my madness, so to speak. I'm here to talk about the lymphatic system. Some of the things I'm going to discuss is going to overlap a bit with what Dr. Campbell had said earlier on, but this is just a general rendering of what our lymphatic system looks like. Basically, a normal lymphatic system is just another bodily system that transports fluid. It's closely associated with the cardiovascular system. The difference being that the cardiovascular system has a heart to pump the fluid around our body. Our lymphatic system has no such pump, and it relies on movement of our body. Hint, hint, that's why we stood up. So there's no pump in the lymphatic system. So lymph is composed of a couple of different things. First of all, obviously water, white blood cells or other cell fragments, proteins, and in the gastrointestinal area, this doesn't show that there are lymph nodes here, but there are a lot of them, you'll see some fats in the lymph as well. So what does the lymphatic system consist of? It consists of lymphatic vessels. They start off big and they get smaller and smaller and smaller as you get closer to the outside of your skin. They're called lymphatic capillaries. And then of course the lymph nodes, which by now we've heard a million times that terminology. There are two different things actually that remove waste products from our tissues, and that is the lymphatic system and our veins. So once this fluid is in the lymphatic system, it travels through these lymphatic vessels, and as it gets deeper into your body, the bigger, thicker vessels will start contracting, kind of like our gastrointestinal system contracts to move food along. Well, these vessels can start contracting a little bit to move the fluid along for you. It's ultimately filtered into the lymph nodes, and from the lymph nodes it gets dumped into the heart. So what happens when there's an impairment of the lymphatic system? There's actually non-cancer related causes of impairment. Congenital infection with fungi, bacteria, parasites. Usually that's a third world country problem. We don't see that too much here. And chronic venous insufficiency. But of course we're here to talk about cancer-related causes. So if you have malignancy in a lymph node or a portion of the lymphatic system, that's going to restrict a flow of that fluid. Any kind of surgical removal of lymph nodes. Chemotherapy actually can sometimes create the onset of a lymphedema or impair the lymphatic system for reasons unknown at this time. We talked about, or Dr. Campbell and Dr. Undermeyer both talked about radiation therapy being a risk factor for impairment of the lymphatic system, and any kind of surgical procedure that's going to disrupt those vessels and disrupt lymphatic flow. So let's talk a little bit about reproductive cancers and breast cancer. So in the case of breast cancer, they'll often sample or remove lymph nodes from the axilla or the armpit. And what happens is normally the entire arm, the entire upper quarter, meaning the breast, the trunk, the back, all that tissue tends to drain to those lymph nodes. And if those lymph nodes are removed, then you can get a buildup of fluid. And that buildup can happen. It can happen in the arm, in the breast, in the trunk. Very occasionally we'll see it in the neck. And conversely, in the case of ovarian cancer, reproductive cancer, when they sample lymph nodes or remove lymph nodes from the pelvis, you can get a buildup of fluid in the abdomen, in the pelvis, or in the leg. With this backup of fluid in these tissues, protein can remain in the tissues. What's important to know about protein, I don't know if you've heard of the term of lymphedema being associated with a protein-rich swelling. Well, we talked about proteins being part of the lymph. Proteins, if you can imagine, are like teeny tiny little sponges. So you have these protein molecules in between all of the cells of your tissue that normally leak out. Those protein molecules normally go into the lymphatic system and are dumped back into your heart. However, if there is an impairment of the lymphatic system because of surgery here, surgery in the pelvis, then those proteins stay there. Again, picture them being teeny tiny little sponges. If the proteins stay there, they're going to be pulling more water towards them. So hence the term protein-rich swelling. That's the bad news. The good news is the body can find ways of compensating for this. Sometimes new little lymphatic vessels will grow. Sometimes the lymphatic vessels will attach themselves to veins. So we talked about what the lymphatic system is, what an impaired system would be, and let's talk about lymphedema and the different stages. The first stage is actually stage 0. It's called a latency stage, and you are stage 0 if you have basically had any lymph nodes removed. You won't see any visible swelling in your body anywhere, but you are at risk. Your body's still kind of compensating for the loss. You may have some kind of vague symptoms, like maybe some achiness or heaviness or some pulling, some numbness, some tingling, that sort of thing, but you won't see any swelling. Stage 1 lymphedema. This is when the lymphatic system is already overburdened. But the good news is it's actually reversible at this point. Elevation would be helpful at this point to get some of the swelling down. Sometimes the swelling gets kind of a thick, sort of a putty or a gelatinous sort of feel to it. You could put your finger on your hand or the top of your foot and kind of see an indentation there. But there's no tissue damage, so you can still get back to your normal. Stage 2 lymphedema is where this fluid starts attracting more connective tissue, kind of fibrous tissue that sticks in there, and it makes your tissue feel a little bit more firm. It is not reversible at this point. You start getting some damage to the soft tissue. Elevation is not going to get rid of the problem at this point. Stage 3 lymphedema is where you see very large lobes of tissue. You'll see severe fibrosis, that really thick connective tissue. You may feel a leathery sort of feeling to your skin, and it definitely increases your risk of developing wounds and inflammatory processes. So of course we want to talk about prevention, or I actually like the terminology risk reduction a little bit better, because sometimes things happen and we don't have any control over them, like Dr. Campbell had said. So one of the things you can do is, if you're a surgical candidate, you may want to talk to your doctor about seeing a therapist post-operatively to learn specific exercises for your situation and to just be educated on certain things, and some of them are what we'll talk about tonight. The second thing I know seems so simplistic, but the fact of the matter is the higher your body mass index is, the higher your risk of developing lymphedema. And then little precautions that you can take. Try to avoid blood pressure, injections, IVs on your affected side. You want to be really adamant about this. For instance, if you have a risky arm, have all your procedures done on your other arm. If you have bilateral situation, bilateral cancer, then you're at risk on both sides. Tell them to use your legs, and again, just be very adamant about it. Okay. Other things that you can do for prevention. Well, we all want to experience fun in our lives and have leisure activities, but you don't want to spend all your time worrying about getting lymphedema. So what I like to tell people is your main goal is to reduce the risk of getting inflammatory processes. So let's talk about a couple of things, and this is just the tip of the iceberg here. A lot of times in our sessions, we'll talk specifically about what you do in your life and how you can reduce your risk for your particular activities. But for instance, going out in the sun, this is Florida, you'll want to wear sunscreen to prevent a sunburn. Sunburn creates an inflammatory process. Inflammatory processes might lead to lymphedema. Take precautions in mosquito-infested areas. Again, this is Florida, so you might want to have bug spray. Keep it in your car, keep it in your purse. If you are a gardener, make sure you wear your protective gloves. Go online and find some gloves that go a little bit longer. Maybe wear long pants if your leg is affected, or legs. You want to minimize severely straining your muscles, and I'm talking about going to the gym and bench pressing 300 pounds. The things you do in your normal everyday life, picking up a basket of laundry, putting the dishes away, lifting a baby, lifting a grandchild, that's not severely straining your muscles. That's your normal. So it's okay to do those things. So you definitely want to incorporate some kind of exercise into your life, and hey, that applies to all of us, cancer or no cancer. Exercise is so important, and there's so many benefits to it, but specifically as a way to reduce your lymphedema risk. And then different things with your clothing and jewelry. You don't want your clothing to be too tight around the waist, around the arms. You don't want your bra straps to be too tight. That will just occlude the flow of lymphatic fluid. Let's talk about travel a little bit. And we've got kind of two scenarios here. We've got the scenario where you're at risk for lymphedema and the scenario where you have lymphedema. So for those people who are at risk, I like to recommend, or we like to recommend in our clinic, that you do get a compression garment prior to your flight. You know, a sleeve or a glove for the arm, or a stocking for the leg. Sometimes you can get a prescription from your doctor. There are local companies, and we have a list, it's sitting over there by Rhonda actually, of local companies where you can get it done. Or if you happen to be in therapy, we will measure you specifically for your compression garment. But in any case, we do like to recommend that prior to travel. And then if you already have lymphedema, of course you're going to wear your compression garment when you travel. You may even want to do some additional compression. But for air travel, think about it. When you fly to go visit some family members, your day is crazy. It's not your normal day. You're rushing around. You're not eating healthy. You're not hydrating enough. You're carrying heavy luggage, perhaps. You're holding on to things that you normally don't do. You hurry up and rush, and then you sit. And you sit in the airport. And then you sit on the plane. And then you get up and you rush around. So there's so much unusual activity for your body. Another thing to consider is that while you're actually on the plane, there's reduced cabin pressure, as we've heard before. That's why your ears pop. And fluid moves from an area of high pressure from within our cardiovascular system through our capillaries to an area of low pressure. There'll be more fluid leaking while you're on the plane. So if you have a compression garment, that's going to reduce the amount of leakage from those capillaries. We like to recommend that you put your compression garment on 2 hours before your flight, wear it on your flight, 2 hours after your flight. We also like to recommend that you keep your body moving, because as we talked about, not only the lymphatic system is going to drain that fluid, but your venous system as well. We have lots of veins running through our muscles, and if we can pump our muscles to activate the veins, those will be more effective in drawing the fluid out and make your lymphatic system work that much easier. So my recommendation is make sure you look absolutely ridiculous while you're sitting on that plane. Reach up, bend your arm, reach up, sit down, stand up, sit down, stand up, go for a walk, and that ensures that you are getting the physical activity that you need during that time. And for automobile travel, you don't necessarily need a compression garment, but you are sedentary. If you're going to drive down to Miami, you're going to be sitting there for 5 hours. So again, I'd recommend to do some exercise when you're sitting there, stop frequently, eat healthy, hydrate, kind of the same thing that applies there. One of the things we do here at St. Joseph's is LDEX testing. It stands for the Lymphedema Index, and it can be performed prior to breast cancer surgery. At this time, we don't have anything for gynecological cancers, and it's done at predetermined intervals, usually 3, 6, 9 months, 12 months. And it's basically these little electrodes, if you can kind of see right here, are placed on the skin, and a current is passed through. It's harmless, it's painless, but it just detects how much fluid is there, and you do this before surgery to get a baseline. So your surgeon will have you come back to see our LDEX technician, Arlene Suarez, who's back there. Hey, Arlene. And she'll do it on those 3, 6, 9 month intervals, and if she detects an increase on her machine right here, then she will alert the doctor, and then the doctor can send you to us for therapy if necessary. So what happens when you have an existing case of lymphedema? Our treatment is called complete decongestive therapy. We're decongesting a extremity. It consists of 4 different steps. One of them is skin care, and that's basically preventing that inflammatory process that I talked about earlier. We suggest applying lotion to your skin on a daily basis. It seems so simple, but what that does is it keeps your skin a little bit more supple and reduces the chances of cracks occurring and getting infections. And of course, any nicks and cuts that you get, be right on top of those nicks and those cuts and those scratches from your cats. Clean it off with warm water and soap. Apply antibacterial ointment on there. Just keep your skin really nice and clean. The second part of treatment, it's a big part of what we do in therapy. It's called manual lymph drainage. We initially do that for you and ultimately teach you how to do it yourself. And the purpose of this is to kind of reroute the fluid. So we move fluid away from where the lymph nodes were removed or damaged by surgery or all those other processes, and we move the fluid manually to healthy lymph node areas. One of the techniques that we use is the technique is called manual lymph drainage. It's a special light touch skin stretch, and that skin stretch just kind of opens those lymphatic vessels so the fluid can flow in. The next thing is compression therapy, and you heard my little cash register. One of the reasons why I did that is because unfortunately not all insurance companies cover the compression therapy. Most of them cover the therapy itself, the manual lymph drainage, but they don't necessarily cover the compression garments required to sustain the improvement that you made. But in any case, there are different ways we can do this. When you're first in therapy for lymphedema, we'll apply this compression bandaging here. It kind of looks like an ACE wrap, but it doesn't stretch quite as much, and it looks very, very daunting, and to be honest with you, it is, because it's bulky and it's thick, but it accommodates those rapid changes that you're making almost on a daily basis in your lymphedema therapy. Once we get to a point where the girth or the size of your limb is not going down anymore, we'll go ahead and place an order for these type garments. And then, of course, the exercise that I talked quite a bit about. It's important for a couple of reasons. Exercising parts of your body that are not involved may stimulate lymph nodes in that area that we want to make sure are really active and pulling as much fluid as possible away from your affected area. So if you have a problem with your leg, we may still give you neck exercises or abdominal exercises. If you have a problem with your arm, we may do some side stretching like we did earlier. In our clinic, we like to kind of customize an exercise program for you. It depends on what your limitations are. Some people have shoulder problems or back problems or whatever, and we try to customize specifically for you. And here are just some before and after pictures. And I'll be honest with you, these are good pictures because it truly shows you what we see on a daily basis. So finally, my suggestions would be, if you end up coming to therapy, follow your instructions. You will be given a program to follow on your own so you can learn to manage this condition on your own. It is manageable. You can do it. Don't assume if you've had that sentinel lymph node biopsy in the case of breast cancer, or if you've only had 1 or 2 lymph nodes removed in any of your cancer surgeries, that you're not at risk. Yes, it lowers your risk. It does not eliminate it. Don't assume that you won't get lymphedema if your surgery was a long time ago. We have seen people 15, 20 years post-surgery who develop lymphedema. Not very common, but it does happen. Immediately consult your physician if you have any sign of infection. That redness, that warmth, the pain, fever, any sign of infection that you might have. If you have compression garments, get them replaced every 6 months. Your private insurance companies will pay for that. As a matter of fact, private insurance companies will pay for 2 garments every 6 months, 1 to wear, 1 to wash. And my last thing, if you have not figured out, my mantra for today is exercise, exercise, exercise. And just one quick little story. I just want to tell you that I have never had an individual who is a regular exerciser, and I'm not talking about a marathon runner or somebody who does triathlons, but just somebody who does basic exercise, goes for a walk, does some light weights at home. I've never had somebody develop that really bad stage 2 or 3 lymphedema. Because they're pumping those muscles, they're really reducing their risk just by doing a daily or 3 times a week exercise routine. Thank you so much.